All right, happy Thursday, everyone. So we will be starting the press conference in just a few minutes. Just wanted to give you an opportunity to get settled in, and we will be back very shortly.
Can we hear me? Okay. You can hear me? Okay, good. Good morning. My name is Ellen Wiss, and I am joined by my co-chair, Jennifer Krishka, for the Florida Women's Funding Alliance, to thank you all for joining us for this exciting moment. You'll soon be the first to hear about the findings and recommendations of our latest research report titled Research to Action, Making Girls a Priority in Florida. The Florida Women's Funding Alliance, or FWFA, is a collective group of women and organizations working together to help transform the lives of women and girls through members' collective voices and resources. Our fiscal agent is the Women's Foundation of Florida in West Palm Beach, and we are pleased to have representation here today by Executive Director Takeda Pang. FWFA envisions a Florida where women and girls thrive. Most of you on this call helped fund the three-part Status of Girls Research Report publications by the Dolores Barr Weaver Policy Center. Two of them were released in 2019, and this final report is being released today following this webinar. As a collective, we funded this research to learn about barriers to progress specific to girls in our state, to investigate indicators of their well-being, and to learn where to invest and to improve their outcomes. We appreciate those of you from the press here today and welcome your support in bringing attention to these important findings. We hope you all are pleased with our collective investment. We have work to do, but armed with the research and recommendations, we are equipped to act now. Thank you for making it possible. Before we get started, we have a few housekeeping items. Your microphones will be muted throughout the webinar unless you are a speaker or moderator presenting or a member of the press with a question to pose. Questions following the presentation are allowed for the press. Please utilize the Q&A feature to submit your questions. This is being recorded. And now it's my pleasure to introduce the presenters today. Dr. Vanessa Patino-Lydia, Vice President of Research and Planning at the Dolores Barr-Weaver Policy Center and co-author of the Status of Girls series publications, will be presenting an overview of the latest research findings. Jennifer Krishka, CEO of Jewish Women's Foundation of the Greater Palm Beaches and co-chair of the Florida Women's Funding Alliance, will be moderating the follow-up Q&A portion of this webinar. Panelists for the Q&A portion include all of the authors of the reports from the Dolores Barr-Weaver Policy Center. Here with us are Vicky Basra, President and CEO, Dr. Lawanda Rivera, President Emeritus, and Vanessa Gordon, Research Project Manager. Dr. Patino-Lydia will now turn it over to you. Thank you.
Good morning and welcome, everyone. I have focused the last 15 years doing research on the most invisible girls, many who are impacted by the justice system. The Status of Girls research calls for bold action, starting with launching a statewide campaign to make girls a priority. Critical reforms to address the well-being of girls is long overdue, and the pandemic has really put an exclamation point on the disparities in education, safety, health, and economic inequities. We must do better. To kickstart the reform, we are calling for a 2-day summit to share the research in partnership with girls and to build public awareness about why the time is now to make girls a priority in Florida. The Status of Girls research not only spans juvenile justice policy changes, but also the importance of education and communities as critical parts of this movement. Every year, we are losing girls in Florida. Almost 3,000 girls dropped out of school last year. 25 died due to suicide. Over 7,500 girls were removed from their homes due to abuse. There were over 1,500 investigations into victims of sex trafficking. And over 9,000 girls were arrested in 2019. NPR just recently reported a study that estimated that as many as 3 million students may have dropped out of school since March. And another recent report found that of the jobs lost since February, the majority were for women. We do not yet know the full impact of COVID, but from our research last year, we do know that before COVID, girls in middle school and in high school were experiencing alarming rates of violence and victimization in their communities, in their schools, and in their homes. 1 in 10 girls had reported being raped. 1 in 3 girls reported not feeling safe at school. And 1 in 3 girls reported that sometimes she didn't feel life was worth it. COVID exacerbates these indicators of well-being. We are concerned about the impact of the pandemic on girls' well-being and mental health, how family pressures may be exacerbating stressors at home. Research documents that often these stressors are internalized more frequently among girls and women. And not being in school, not having access to supports, has led to a host of other challenges, including isolation, less access to services, and more educational barriers. The reported rates of hopelessness, suicide ideation, substance use, and lack of support among girls must compel our communities and state to take action. The report calls for communities to convene listening sessions across the state to hear from girls and their families on these issues. Our research clearly shows that girls of color, girls from rural areas, and girls that identify as lesbian, gay, bisexual, or transgender are experiencing even greater inequities. For example, girls from rural areas have higher dropout rates. Girls of color are reporting feeling less safe at school, greater sadness, and greater hopelessness. Girls who identify as LGBT are reporting higher suicide ideation and experiences of sexual violence. Based on the research findings of the first two publications in the Status of Girls series, this third report offers long and short-term policy and practice and training and public awareness recommendations on how to close the disparities in educational attainment and overall well-being specific to girls. We have an opportunity to positively shift how girls will experience their communities and school environments. The report calls for specialized training across the board. Educators and school resources officers need to be prepared to address early warning signs of mental health conditions and how to link girls to services. Understanding the impact of racial trauma and sexual trauma will help therapists better meet girls' needs. And from a systems lens, training our child protective investigators who are working with girls who are victims of trauma, as well as training our law enforcement, judges, attorneys on decision-making for girls who are referred for prosecution is critical. As the Florida legislature is convening, today I want to talk about 3 policy recommendations that can have an immediate impact on shifting disparate educational attainment and overall well-being. First, ban the suspension of students in kindergarten to 3rd grade, similar to what other states and jurisdictions have done due to dress code violations and other subjective behaviors to address the long-term educational attainment disparities. Second, limit the arrest of youth under the age of 10, similar to states such as California, Texas, Louisiana, and DC. Establish protocols between law enforcement and school districts to reduce the arrest of students who are not a public safety threat. Third, release girls in detention who do not pose a public safety risk and coordinate local community-based alternatives to get them back connected to their communities. And in addition to these immediate policy recommendations, invest in programming that increases girls' access to trained therapists, school advocates, and safe and inclusive spaces. Florida ranks 40th in mental health access for children. We recognize there are multiple places to intervene, and the intention of this report and study is to help build a strong foundation that will lead to sustained shifts in policy and practice and improve the well-being of all girls in Florida. We can do better. We must do better because our children are counting on us. Thank you for your time. I will now pass it back to Jennifer Krishka so she can moderate the question and answer panel with the report authors.
Thank you, Vanessa. So if there are any questions, please go ahead and submit them through the Q&A feature, and then we'll be happy to answer them. So far, no questions coming in. All right, I guess it was a pretty straightforward report. Okay, so what can we do as citizens, staff members of various nonprofits, et cetera, to help policy changes for, positive impact for girls in Florida?
Take that one. There is really a role for all of us in this work. And you can certainly learn more by starting to read all the research and see specifically what's going on with girls in your community. You can get involved, take the research to your local school board, share the information, and you can also sign up. You can sign up on the Dolores Bar Weaver Policy Center's website to our mailing list, as well as the Florida Women's Funding Alliance, and learn more about the legislative priorities for this year and more about the work that we're doing so you can stay connected.
Thank you. So a few more questions came in, and again, please submit the questions to the Q&A feature instead of the chat feature. Okay, so first question that just came in. So what do you view as the most important finding of the report? That's a good question.
Gosh, well, there were so many critical findings. Clearly the victimization being incredibly rampant. I would say, from my experience in looking at life histories of girls that are impacted by the juvenile justice system, I would say the thing that was most striking to me is that we are talking about girls in middle school and high school across our state and in our communities, and the level of hopelessness, and that 1 in 5 girls reporting suicide ideation, that 1 in 10 reported having an experience of being raped, was striking. And I think calls attention to the opportunities to really intervene right now in the lives of girls. This is not a retrospective study of having these conversations with girls when they're young women or adults, but it's happening now, and it's very relevant. And so we can be intervening in all the spaces that girls are in.
Thank you. And I'm going to respond to that too, just as, one of the organizations that's part of FWFA, and, we'll certainly be using this report to help guide some of our grant making and education and advocacy work. So I will say that one of the things that was very jarring for me when I read the reports was the number of girls that are just missing, that we don't know where they are. Okay, so another question is, what about preschool suspensions?
Take that. We don't report the data of preschool suspensions, but we do know that they are happening in VPK, and certainly we are advocating for no one to be suspended before 3rd grade. So that would include preschool as well, and training preschool teachers and making sure that we have early preschool intervention and education accessible. And Lawanda may want to add to that.
I would add certainly that it also calls for an investment in quality pre-K, where that we make sure that we have the teachers and the staff who are in those programs who are really equipped to address the issues that we see in this report that our children are bringing into the classroom. And one of the recommendations that you will see in the study is for an investment in quality pre-K for the state of Florida, so that all children have access to the educational opportunities that we want, and that readies them for school, because that sets them on a very different path.
Thank you, Lawanda. All right, so next question is, with the increase of isolation due to COVID-19, what impacts do you see moving forward into 2021 on our girls? For example, increased hopelessness and suicidal ideation. And what are the recommendations, I guess, to mitigate any of these impacts?
Vicki.
So I think that one of the things we're seeing immediately is really the continued disconnect. So I think we were hoping that we would be able to keep our girls connected via online school, other systems, but really these systems we've put in place aren't working and girls are not staying connected. And part of that is because our teachers are not trained, many of them are not trained properly to know how to utilize these, these various systems that have been put in front of them. Many of them are in classrooms where they have live students and they have online students at the same time. And so how do you keep both engaged, right? And so right now, we're still, and I think it's a crisis. We're in a crisis. And so it's not anybody's specific fault. But at the same time, we're continuing to lose more and more children every day because we also have a system where parents are still having to go to work, especially those that are our frontline workers, that are necessary workers. And this system is, who's losing out at the end of the day are the girls we serve. And so this is where we have to invest in programs that are able to keep these girls engaged in different ways. It's after school programs, it's programs that are in the communities where these girls are, that are able to check in, that are able to fill those gaps that right now the school isn't able to provide, that parents are missing. And so I think it's really, really important to shift where our funding is going and how we are providing money to look at what are the gaps, how do we connect with these girls, and who are they engaging with? And who they're really engaging with are their mentors, with their support systems, which are not in the school right now and are not necessarily their parents.
And
I think, I was just going to add to that also. I think, that's a significant hope for all of us, I think, is that organizations that are directly serving girls will take the information from really all three of the reports and think about how best to apply that to their work. And so there may be shifts that are made by direct service organizations and even social change organizations in terms of how they think about, what girls' needs are. So I certainly hope that everyone that is watching right now who does work with an agency or an organization that does serve girls will use this research.
And I would add, from a research perspective, we have already tools. The Department of Health has its survey that goes out to all the students in schools across our state that asks these questions. So we want to make sure that we're including, so the data that we've shared are sort of our baseline indicators, right? This is where we are. We don't even know the impact of COVID, but we'll have data now to actually assess what is changing. Is suicide ideation going up? Is isolation going up? Like what are the additional disparities that have been created? And it's also an opportunity, Jennifer, as you say, for our providers and those working with children, and particularly with girls, to have listening sessions, have a survey, collect the information. How are you experiencing this pandemic, and what are your needs? How can we help? And really respond from that perspective to make sure it's aligned with what it is that girls are really experiencing and what they are sharing they want to change.
Yes, and also if you're really interested in this kind of work, FWFA, of course, will be moving forward with different activities, of course, using the research. And so if you're interested, please get in touch with us. We'll put the website up at the end of the webinar. But if you're at all interested in getting involved with FWFA, please certainly reach out to us so we can tell you more about what we're doing. All right, so a couple more questions coming in. So there's a question about providing in-school access to mental health services, and I guess how that addresses girls who don't feel safe in school, and how we get, I guess, mental health services to girls if they don't feel safe in school. So who would like to take that question?
So I think again, it's a multi-layered, question. I think mental health services, first of all, have to be readily available in spaces that girls feel safe. And part of that means it's our responsibility as adults to create a trusting environment. And that means, like Vanessa said, really listening to what are the needs of the girls in the specific school that you're working in. And depending on the community you're in, depending on the school you're in, the needs may be very different, right? What are the lived experiences of the girls in the community that you're working in? And so what is it that you as a school, as a therapist, as a clinician, need to walk in the room with to create a safe environment? It's not a girl's responsibility to create safety. And so we need to start with sitting with the girls in our environment, in our school, and ask, what is it that's not helping you? And I think this report does a great job in helping to start that conversation, but let's take it a step forward and continue that work in our schools and environments and ask, what is it that we're doing that stops safety from being created in our school environments? I know that there are programs out there that have Girl Matter classrooms, which are specifically, classrooms that girls can go to when they're not feeling safe or they're feeling a disconnect. And there's an understanding in the school where a girl can raise her hand in the classroom and say, I need to take a break and I need to go meet with my intern or my mentor, or, and go to this classroom and be able to have a conversation in a safe place where trust has been built. And so there are models within Florida that are doing this and have already created safe environments for girls to be able to have these conversations, to have their mental health needs met. And so being able to build this in all of our schools is a possibility, and it's something we can do.
I would add that the report has an appendix that lists lots of different resources and gives a sample of what other locations, jurisdictions, and states are doing and bringing forth, and ways that they're creating inclusive and safe spaces, bringing in restorative practices, bringing in sanctuary rooms, shifting their entire paradigm and policies and practices in their school setting, in their classrooms, and in their trainings. So I hope you'll check out those resources and see what other organizations are doing and what states are doing that we can bring to Florida.
And I would add to that, Vanessa, after really looking at the report and what opportunities and models are happening across the country, and also in Florida, begin to advocate with your local school district on what would be the programs and services that you would like to see brought into your school, and make your voices heard so that these kind of services and opportunities can be available for the girls locally.
Thank you, LaWanda. So another question that's come up, did family makeup play a role in any of the findings? For example, single parents or two-parent homes, etc.
So the short answer is no. We pulled data from the Florida Youth Substance Abuse Survey and data from the Youth Behavioral Surveillance Survey, and none of those surveys have variables where girls can identify what their family makeup is like.
All right, thank you, Vanessa. So we have a couple minutes left before this webinar concludes. So it looks like those are all of the questions that have come up from our attendees. I guess, does anyone from the Policy Center want to add any additional comments before we go ahead and move to the final slides? Okay, I guess we can go ahead and then just, oh, another question came in. The question is about the report and when it will be public.
It is actually been released right now as we're talking. So it will be on our website, unveiled. And it's also on the Florida Women's Funding Alliance website, I think right now, as soon as we get off this webinar. So you can download it. And again, feel free to reach out to the Policy Center if you have questions about the research. And we look forward to hearing from you. And we're very thankful for your time.
Yes, and please do share the reports with any organization or individual that you think could benefit from reading it. And not just the one that we are releasing today, but also the previous two reports, which are, really significant and helpful. All right, Vanessa, do you want to go ahead and move to the last slides?
So just to reiterate, these are ways that you can get involved. Read the research that's been released, all 3 studies, and there's other resources also available on our website. Share the information on social media in your places of employment with your colleagues, and use the information in all your spheres of influence. And also, if you would like to get involved on a broader level, join our mailing list and get updates on what's happening this legislative session and how it can impact girls. Contact information. And so if you have specific questions, you can contact Megan McElwee at the Policy Center. Her email address is there, and you can also see our website and our Facebook, Instagram, and Twitter.
Yes, thank you. And then also for anyone that's interested in learning more about FWFA, I'm going to go ahead and just put the URL in the chat. So please do reach out to us, either Taquito or really anyone who's involved with FWFA. We would love to grow the organizations and the individuals who want to partner with us. So thank you so much to everyone who joined us today. We really appreciate you being here. We're very excited about the release of this recent research. Again, please do share that with anyone and everyone that you think could benefit from reading it. Big thank you to Ellen, my co-chair, to the Dolores Barr Weaver Policy Center for producing this excellent research, and Taquita from the Women's Foundation. And we hope that you have a great rest of your day. This webinar has been recorded, so if you're interested in watching the recording or sharing it, it will be posted on the JWF website, which is jwfpalmbeach.org. And I hope that everybody is well. Thank you so much.